We'll speak about bladder tumor, part 20, risk of the cancer in the bowel that is incorporated into the urinary tract. There is increased risk of the secondary cancer in the intestinal segment of ureterostigmoidostomy and also enterocystoblasty. So this is the increased risk of intestinal segment cancer. These tumors are usually adenocarcinoma, unusual intestinal origins, and usually occur at or near to the urethrointestinal border. Even when the urinary stream has been diverted away from the intestine, a urethral remnant left on the bowel may still induce a tumor. Therefore, if an undiversion is performed, remove the entire urethral remnants from the intestinal and the entire intestinal remnant from the urothelium. Ureterosigmoidostomy 2.5% develop malignancy near the uretero-bowel anastomosis with average latency periods of 26 years. Up to 40% develop benign colon polyps after ureterosigmoidostomy. Surveillance with annual colonoscopy should be probably begin 10 years after urinary diversion. So we will do the colonoscopy 10 years after urinary diversion, and barium enema is avoided. Enterocystoblasty 1.7% develop malignancy from the intestinal segments in the bladder with a mean latency period of 20 years. Surveillance with annual cystoscopy should be considered. Malignancy can be developed regardless of the gastrointestinal tissue used for enterocystoblasty. I mean, the malignancy has been reported after using stomach, ileum, or colon. Conduits, catheterizable urinary diversion, and also topic new bladder replacement do not appear to have increased risk of secondary cancer. So the cancer usually comes from the stomach, ileum, and also colon. This has been reported. Selecting intestinal segment for urinary tract. Pelvic radiation consider use transfer colon or stomach because they are further away from the radiation field. So myelomeningocele avoid using of ileocecal valve because removal of this segment might intractable diarrhea. Ulcerative colitis avoiding using colon, and peptic ulcer disease avoid using the stomach. Short bowel syndrome consider using stomach to prevent further shortening of the intestine. Acidosis consider using stomach. Other segments can be exacerbate acidosis. Renal insufficiency consider using the stomach when the creatinine more than 2 because of other intestinal segments may exacerbate acidosis. Diverticulosis consider avoiding the colon. Hepatic dysfunction consider using stomach because other intestinal segments might be excessive level of ammonia. We will come to the summary of intestinal segment. Stomach advantage useful in the patients with pelvic radiation, patients with acidosis, patients with renal failure, and patients with hepatic failure. So this is the advantage of using stomachs. Acid secretion may inhibit bacterial growth and reduce infection, least mucus production of the intestinal segment. Disadvantage is hypokalemic, hypochloremic metabolic alkalosis. Also, hematuria, dysuria syndrome can occur, and hypergastrinemia also can occur when the interim is used, and this is lead to peptic ulcer disease. Jejunum, disadvantage hyperkalemic, hyperchloremic metabolic acidosis, hyponatremia, and bone demineralization when the jejunum is used. Ileum advantage is familiar to the urologist. Disadvantage, hypokalemic, hyperchloremic acidosis can occur compared with the jejunum, which lead to hyperkalemic, hypochloremic metabolic acidosis. with ileum, we have hypokalemic, hyperchloremic acidosis. Okay, again, jejunum, hyperkalemic, hypochloremic, metabolic acidosis. But here we have hypokalemic, hyperchloremic acidosis. And fat and bile malabsorption can occur, diarrhea, vitamin B12 deficiency can occur, and bone demineralization, ileum may not be healthy enough to utilize after pelvic radiation. Ileocecal region. Disadvantage, same disadvantage as ileum. Diarrhea can particularly problematic when the ileocecal valve is removed in patients with myelomeningocele. Colon advantage, transfer colon is less damage after pelvic radiation. Disadvantage, hypokalemic, hyperchloremic, metabolic acidosis as the ileum is the same as the ileum with hypokalemic, hyperchloremic, metabolic acidosis as we see here, hypokalemic, hyperchloremic, metabolic acidosis. Okay, and also most mucus production of the intestinal segments and also bone demineralization can occur. This is the end of this session. Thank you very much.